It's found that of the total global population, more than 1 billion people are actually affected with gum disease or periodontitis. The bleeding will be reduced, the redness will be reduced, and the disease can progress. It is very high that we can have this form of disease at some point of time in our life. This can cause difficulty in your dietary pattern and even affecting your quality of life.
Our skin is the mirror of our soul. Our skin is our largest sensory organ. Our skin needs a healthy microbiome balance. This is regulated by its pH value, which protects the skin from pathogens, cold and ultraviolet rays. Sebamed protects your skin.
The value of health is known only when we fall ill. Good evening, dear friends. Welcome to today's episode of BMC Global Live Al Hilal Health World, Nothing But Lifestyle. This is a talk show with the expert doctors of Al Hilal hospitals and medical centers. Today we will be discussing about an issue that affects millions of people worldwide, gum diseases. And the doctor joining us today is Dr. Ibn Sam Abraham from Al Hilal Hospital, Askar branch. He is a general dentist with an experience of more than 10 years. So, Doctor, welcome to the show.
Thank you so much, and thank you for having me in the show.
It's a pleasure, Doctor. So, Doctor, our topic of discussion is gum disease. So, what exactly is gum disease and how is it different from other dental conditions like cavities?
Yeah. So, to know exactly what gum diseases are, let's have a little understanding of the tooth and its supporting structures. So, the tooth is actually inside the bony socket in the jawbone, and this is actually inside the jawbone. And what you see in the mouth is actually the crown portion of the tooth or the top portion of the tooth. And beneath that we have the root portion, which is actually attached to the bone with the help of certain fibers. And covering this we have the gums or also known as the gingiva. So gum disease is nothing but the disease of the tooth supporting structures, whereas the cavity is actually something which occurs on the surface of the tooth. So that is a basic difference.
Now, can you explain about the different types of gum diseases you usually come across in your OP?
Yeah, so the common gum diseases are gingivitis and periodontitis depending on the stages of the disease. In gingivitis, the disease is limited to the gum or the gingiva alone, whereas in periodontitis, it has actually crossed the fibers and even distracting the bone. So these are the common diseases that we find in the clinical practice.
And how common are gum diseases now?
Yeah. So if you look at the prevalence of the gum disease, as per the WHO Global Health Report, oral report, it's found that of the total global population, more than 1 billion people are actually affected with gum disease or periodontitis. So it's very common in the population, and it's also one of the most common oral disease among the population, and it is very high that we can have this form of disease at some point of time in our life.
Doctor, can you now speak about the causes of gum diseases?
Yeah, so it is not just one factor alone, it is multifactorial, basically in the primary and the secondary factors. So the most common factor is something called as a dental plaque or a plaque biofilm. This is a coating which forms on the surface of the tooth. We could have noticed this slime layer on the surface of the tooth sometimes, and this is actually a network of microorganisms. So this can initiate this disease progress, and this can also become calcified later, forming the calculus. And now the other local factors are the tooth alignment, your plaque retentive factors like your dentures or your fillings, and also there are some risk factors like smoking, and also other systemic factors like diabetes, etc. So these are the common causes of gum diseases.
Doctor, how do habits like smoking and stress affect our gums?
Yeah, so smoking is actually one of the risk factor for gum disease. In smoking, actually what happens is the blood vessels is affected, and the symptoms that are usually shown are masked. So a smoker will not know that he'll be having the disease, like the bleeding will be reduced, the redness will be reduced, and the disease can progress. And also smoking can also affect your immune system and act on certain cells and initiating the disease. And also it can affect your collagen fibers, also leading to the progression of the disease. And stress is another risk factor. The effect of stress on certain glands lead to a release of certain hormones like glucocorticoids, which can increase the blood sugar level, and this can also initiate gum diseases.
Another common query from our viewers is that gum disease is hereditary. Does it run in families?
Yeah, so just like with other risk factors, genetics is also one of the risk factor for gum disease, which means it can be inherited from one generation to the other. So in these individuals, you can find that there is a more destructive, aggressive pattern of the tissue supporting structures, including the bone, and these individuals, there will be an early loss of tooth. So definitely there is a genetic predisposition for gum disease.
Doctor, you already mentioned about diabetes affecting our gum health. How do diabetes and other health conditions affect our gum health?
Yeah, so as we know, in diabetes, there's an increase in blood sugar level, which is known as a hyperglycemia state. And this can lead to complications like macrovascular and microvascular complications like diabetic neuropathy, nephropathy, etc. And along with this, periodontitis is considered as the sixth complication of diabetes, which means, and also periodontitis and diabetes, it has a bidirectional role, which means that if individual having gum disease, it can lead to an increase in the blood sugar level, and also individuals with diabetes, because of the high blood sugar level, it can act on the immune system, affecting certain cells, initiating the disease, and also affecting the collagen fibers, also leading to destruction, leading to the disease. So in both the ways, it is acting. So especially in individuals with diabetes, it's important that you take good care of your oral hygiene.
Can you now explain about the early symptoms of gum diseases?
Yeah. So usually the symptoms that we find are actually redness and swellings in the gums, and commonly there is also bleeding from the gums, especially while brushing. And there can be presence of bad breath, and in later stages there can be mild to severe pain in the gums, and also the presence of gingival abscesses. And later stages, this can also lead to tooth mobility, and there's presence of tooth mobility also. So these are the common symptoms that we find in individuals with gum disease.
So doctor, are gum disease always painful, or can they develop silently?
Yeah, so that is another important thing. Usually gum diseases are painless. So in the early stages, you may not find any pain, and because of that, it can be left untreated, and the patient might not know about it. But this can actually lead to a progression of the disease,
Doctor, how often should a person visit the dentist checkup for the gums?
Yeah, so ideally, actually, you have to visit the dentist at least once in 6 months' time, and depending on the treatment that we take, the follow-up can be even in 1 or 3 months' time. So ideally speaking, 6 months in 6 months, you should visit the dentist for your checkup.
And another common question is the gum disease completely curable, or they just manageable?
Yeah, so like many other diseases, in the early stage, gum disease is definitely reversible and is completely curable. But once the disease progresses, it can be kept well under control with the proper treatment. It is just like your diabetes. If you are kept well under you can keep it well under control, and similarly the gum disease also you can keep it well under control. It is manageable.
And doctor, what are the treatment options available for gum diseases?
Yeah, so the treatment, it can be broadly classified into the non-surgical and the surgical aspects. In the non-surgical, we have the mechanical debridement. That means we can go for removal of this calculus from the surface of the tooth, and sometimes even it's on the root surface deeper, we can go for a procedure known as a root planing. And along with this, we have this antibiotic regime that we can use for the infections. And coming to the surgical aspect, we can go for a procedure known as a flap surgery, where we actually reflect the gums a little and expose the bone. And in this region, we can go for the debridement and even gingival curettage. And looking at the defects, you can go for bone grafts and also regeneration of this defects using techniques like guided tissue regeneration.
Doctor, what's the correct way to brush and floss our teeth for gum health?
Yeah, so actually we all brush our teeth, but we have to make sure that we do it at the with the right technique. So ideally speaking, we have to keep the toothbrush at an angle of 45 degree to the gums, and including 2 to 3 teeth at a time. We have to go for a back and forth motion with a sweeping motion. So with this, we can remove the debris from the interdental areas of the tooth. And on the occlusal surface, we have to go for the back and forth motion. This is actually called the modified Bast technique. So this is the ideal way of doing the toothbrushing. And regarding the floss is available as a string or even with the handles. So it can be placed between the teeth in the areas called interdental areas, and can remove the debris from this region.
Doctor, are mouthwashes actually helpful? What is your suggestion?
Yeah. Actually, with the toothbrushing, we have certain limitations to access the certain areas of the teeth. So for this, we have mouthwashes which are actually in the liquid form, which can seep through different all the areas of the teeth, and they also have this antimicrobial action, which can help to disrupt this plaque biofilm. So it is very useful along with your toothbrushing.
How is gum diseases linked to heart diseases, stroke, and other systematic diseases?
So this gum disease is actually initiated by the dental plaque, which can actually trigger an inflammatory response. So this can actually lead to changes in your blood vessels, leading to proliferation and thickening, and leading to clot formations. And this clot can be taken into your blood circulation, leading to cardiovascular and cerebrovascular events like stroke.
And doctor, how does poor gum health affect pregnancy?
Yeah, so in pregnant women, we know that there will be changes in the hormonal levels, which can actually cause gingival inflammations. And this gingival inflammation, and along with this, if you have the oral hygiene is not maintained well, you can actually lead to inflammatory process, and this can even lead to preterm birth and low birth weight in pregnant ladies. So it is very important that they maintain a good oral hygiene to avoid these complications.
Doctor, can you now explain about the long-term consequences of ignoring gum diseases?
Yeah, so it is a progressing disease, and in the initial stages, it may not be painful, and so it can go left untreated. And once it progresses, it can damage the surrounding portions of the tooth, that's including the bone, leading to tooth mobility and eventually tooth loss. And this can cause difficulty in your dietary pattern and even affecting your quality of life.
And doctor, what is your one key message for our viewers regarding gum health?
So one thing I want to stress is gum disease is a progressing disease, and in the early stages it may not be painful. So if it's left untreated, it can progress and leading to tooth mobility and tooth loss. And also it can have an effect on the systemic health even in diseases like diabetes and cardiovascular and cerebrovascular diseases. So it's very important that you have a proper checkup with the dentist to avoid the disease progression.
And finally, doctor, what do you have to say about Al Hilal Healthcare Service?
Yeah. So Al Hilal, we are the largest healthcare group in Bahrain, and we have all the specialties of dentistry at Al Hilal. And we, as a team of doctors, we can take care of all your dental related issues and provide the latest treatment modalities. And please do visit us to avail these treatments and to improve your oral health. Thank you so much.
Thank you, doctor. Thank you very much. So viewers, I hope this episode was helpful. For more informative episodes, tune into BMC Global Live Al Hilal Health World every Tuesdays at 8 p.m. Stay happy, stay healthy, keep smiling. Till we meet again next time with a new doctor and a new topic, this is Jasila Mujib signing off. Good night.
Our skin is the mirror of our soul. Our skin is our largest sensory organ. Our skin needs a healthy microbiome balance. This is regulated by its pH value, which protects the skin from pathogens, cold and ultraviolet rays. Sebamed protects your skin.